Hello and welcome to Healthy Living in Pinewood Studio here in London. My name is Femi Oduntan. Today's topic is about women in fertility and health. With us is Ankita Sharma. She's a medical ultrasound practitioner who works in Harley Street area of London, which is famous for its medical experts. She teaches sonography to consults across London, and she has experience working with medical imaging. Not only that, she also a holistic health speaker and now expanding her expertise into digital app-based imaging. Welcome to the show and thank you for joining us.
Thank you for having me.
All right, I want to ask, what is ultrasound?
Well, ultrasound is the most commonly used medical imaging exam that's out there. It's basically using sound at a frequency where we cannot hear it to look inside the body and check for diseases. So we can actually see body parts moving. We can see the heart moving on ultrasound. We can see livers. We can see the uterus. We can even see when a woman's on her period, we can see how the lining's going out. So it's real time. It means we can see movement in the body and it doesn't involve any radiation like X-ray. So usually when you go to your doctor and you say, I've got bellyache or something like that, your doctor will say, okay, we need to do an ultrasound. And then you go to a sonographer or sonologist to get your exam done.
All right, thank you. I want to ask this next question. What's the best way for a woman to test for an ultrasound?
When a woman goes to get her ultrasound done, the first advice I would give a woman is ask who is doing her ultrasound. Because one of the problems we're facing in the medical imaging world is that there's many parts of the world, including here in the UK, where ultrasound isn't entirely regulated. So there's many fake ultrasound practitioners and places cropping up. Basically, anyone can say, yes, I can do your ultrasound. They can get a machine and start doing it. It's really scary, actually, because as a patient, you have no idea what's going on. But at least with X-ray, you know what bones look like. With MRI, you kind of know what the inside looks like. With an ultrasound, it's all grayscale. It's one of the most difficult imaging modalities to interpret. And there's some people out there that are taking advantage of that and giving fake diagnoses. So the most important thing is whenever you go to your practitioner, it's okay to ask and say, are you certified? Which governing body, regulating body are you certified with? Wow. And then go from there.
Okay, so when a woman has miscarriage and what is the best way or what is the best option for one to take a quick, like see a doctor or quick ultrasound?
If she's going through a miscarriage, how to get a quick ultrasound? Well, first of all, many women that they think they're going through miscarriage, they usually aren't. They think if they're bleeding, it's a miscarriage. Often bleeding is actually really normal during pregnancy. Many women don't realize that.
Really?
So most women do bleed. A lot of women will have a little bit of bleeding. It's called implantation bleeding. Okay. So as that sac is going into the uterus, it's a very invasive process. So think about a tree digging its roots into a very thick barrier. That's what it's like. So if a woman starts bleeding, she thinks she's having a miscarriage, she can immediately go get an ultrasound right away. Now, 80% of pregnancies, well, I would say 80% of miscarriages happen before 12 weeks. So if the woman is pregnant, she's 16, 17, 18 weeks pregnant, and at that point she's bleeding, that's not very normal at that point. So the bleeding that I'm talking about usually happens in the early stages of pregnancy, but then it should stop.
When a woman is trying for having a baby or trying for fertility, what is the best option?
You know, that's kind of an interesting question because I see patients from all over Europe and, of course, England that are going through fertility treatments and they come see us. And one thing I will say to a woman who's trying to get pregnant is don't try to get pregnant. I truly believe that it's a psychological process.
Okay.
And now there are studies proving, there was actually a study done by Oxford University which related stress to a woman getting pregnant. And they actually did find that stress does affect a woman's chance of getting pregnant. Now on ultrasound, there is a test that we do, and most doctors don't know about this yet. It's fairly new, so acupuncturists are the ones that are bringing this in. And it's a test of a resistance in one of the arteries going to the uterus. Now what I mean by that is, if a woman is really stressed, the blood flow going into her uterus will not be very strong. So when you're stressed, think about your arteries tensing up like that. And that's what's happening inside your uterus. Everything is tensing up like that. So in the holistic world, they've started using ultrasound to actually check this blood flow. And we're finding that women who have a very high resistance to blood flow, as in there's not enough blood flowing through, they're having a hard time getting pregnant. And the other thing I've seen in my practice is that I get a lot of patients spending thousands of pounds on IVF treatment. Sometimes I had a woman that had gone through 16 rounds.
Wow.
And they go through so much emotional stress. So it's sort of a never-ending cycle, because you're getting treatments, but then the treatments are causing you more stress. So you have to think about holistically where your mind is at. I mean, that's where spirituality comes in,
Yeah,
right?
I know I read something a bit about you being holistic health. Okay, that holistic health approach in women fertility and all that. What is the best? As in, what is the best? What can one use naturally as a woman? I'm a woman here, so I'm speaking for all women all over the world. So what's the best to use?
Yeah, so I had a patient that she was about 46, and she had gone through about 3 failed rounds of IVF treatments. And in the end, she actually just gave up and said, you know what? I guess I'm never going to be a mother. It was hard for her, but she said, I'm going to leave this in the hands of God. And she actually just started just going back into her spiritual routine. She started praying. She spent time with her husband. She said, I'm going to enjoy the company of my husband.
That's beautiful.
And a couple of things that she took, which were for her stress and the inflammation in her body. One was turmeric.
Okay.
That's an ancient herb that comes from India. I use that in our cooking. It's a very good anti-inflammatory. And the other was ashwagandha. That's an adaptogen that also helps with stress levels, and with even people that are suffering from depression should take it. I think everyone should take it. Ashwagandha is very good. So she started taking just regular turmeric and ashwagandha. She took organic brands.
Okay.
And she came to me 3 months later, and I said, oh, did IVF work? What happened? She said, no, this happened naturally. And now she's got a little baby. So imagine her life story there.
Wow, beautiful. Okay, finally now, my next question is the app. What's it all about?
The app,
Can I have an app on my phone and how to do an ultrasound even when I'm not a doctor?
It is going that way, yes. So I'm very interested in digital health, and the future of medical imaging is digital. So right now what we have all over the world is you have really big clunky machines. So you go in to see the doctor or a sonographer, they've got this big machine, and then usually you have to wait weeks for that appointment as well. And they're using older technology. I mean, maybe a little bit of 3D has come in, but a lot hasn't changed. Now think about all of our other gadgets. We don't use a computer that's this big. We don't use a phone that's this big. We've got wireless technology, Bluetooth technology. It's the same thing in ultrasound. So now we have ultrasound where the machine is this tiny, it's wireless, connects to an app, and the doctor or sonographer can come to you in, let's say you're an older person in a care home and you cannot walk about. I could come to you and do your ultrasound and check you and say, look, this is what's going on.
Wow, thank you so much. So much of information you've given us. Thank you, Ankita. And that's all from us in Pinewood Studio. Take care.